Hey guys, what's up? I'm Dr. Jamil, one half of the twin doctor duo that makes up Twin Doctors TV. You've got questions, we've got answers. So today we are discussing a question that pregnant patients always ask my brother Idris and I, and that question is, how far along am I in my pregnancy? Now, you would think, of course, that the answer to that question would be pretty obvious, right? But many times the answer is not obvious, and patients are frequently really confused about how far along they are in their pregnancies. Now this is because they've received numerous different answers from numerous different sources. Well, I'm your source today. So why the confusion? Well, basically the confusion about pregnancy dating exists because pregnancies can be dated one of a number of different ways. Pregnancies can be dated using the first day of a woman's last menstrual period. Pregnancies can also be dated using the likely day of fertilization. And pregnancies can be dated using ultrasound findings. Most commonly, though, pregnancies are dated using the first day of a woman's last menstrual period. So let's talk about that method of dating first. To date a pregnancy using the first day of a woman's last menstrual period, you need to know the first day of the woman's last menstrual period. Duh. You also need to know how long that woman's menstrual cycles typically are when she's not pregnant. Now, armed with this information, you can then use a due date calculator. To use a due date calculator, just go on Google, put in the term due date calculator, tons will pop up. Using the due date calculator, you will then enter the first day of the last menstrual period and the typical number of days between the start of your periods. For most women, this number is going to be about 28 days. Entering those two values into the calculator, you will then be told how far along you are in your pregnancy and what your estimated due date is. And these numbers, of course, are being figured out using the first day of your last menstrual period. Now, as doctors, we like to date pregnancies using the first day of a woman's last menstrual period, but I will admit that this does lend itself to confusion sometimes, and here's why. Ovulation, or the release of an egg that is then fertilized, typically occurs about 2 weeks after the first day of a woman's last menstrual period. So in reality, when we are dating a pregnancy using the first day of a woman's last menstrual period, we are actually kind of starting the clock on that pregnancy about 2 weeks early, because the actual pregnancy will not truly start until about 2 weeks after the first day of the last menstrual period, when the woman ovulates and the egg is then fertilized. So if you are dating a pregnancy based on when fertilization likely occurred, which of course is going to be about 2 weeks after the first day of a last menstrual period, rather than dating that pregnancy based on the first day of a woman's last menstrual period, then it will look as though that pregnancy is 2 weeks earlier than it would be if you were using the first day of the last menstrual period to date that pregnancy. Of course, though, the pregnancy is not actually earlier than you thought it was. It's just that you are now stating how far along the pregnancy is using two different dates to represent the pregnancy starting point. And one of those dates, i.e. the first day of the last menstrual period, is roughly going to be 2 weeks before that other date, i.e. the likely date of fertilization. Now, this confuses some people because their doctor will tell them, say you're 10 weeks along in your pregnancy. But the person knows that they likely actually got pregnant about 8 weeks ago, so they think to themselves, well, how can I be 10 weeks pregnant? Well, of course, now you know and I know that when the doctor tells the patient that they are 10 weeks pregnant, he or she has started the clock on that pregnancy using the first date of their last menstrual period. But of course, the egg that they released when they ovulated and the egg that likely got fertilized was released 2 weeks after the first day of that last menstrual period, meaning that the pregnancy, which is being called 10 weeks old, is in fact 8 weeks old. So, you can determine pregnancy dating using either the first day of the last menstrual period or the likely day of fertilization, and there's going to be a 2-week discrepancy between those two. Pretty easy, right? But then there's another variable that can muddy the waters when it comes to pregnancy dating, and that variable is pregnancy dating using ultrasound estimates. Now, if you've ever been pregnant and if you've ever had OB ultrasounds, then you probably know that each time you go for an OB ultrasound, the results gained from measuring the baby's size will give you different dates, and that happens every time. This is because ultrasound, while accurate, is not exact when it comes to estimating how far along a pregnancy is. And so there is this built-in fudge factor when we use ultrasound results to determine how far along a pregnancy is. This fudge factor has a name, and that name is the rule of eights. And what the rule of eights basically says is this: we will not change pregnancy dating based on ultrasound measurements unless those results show that there is an 8% discrepancy or more between the two dates. Put more simply, if we do an ultrasound and the ultrasound shows that the pregnancy is either 8% further along or 8% earlier than we thought it was using the first day of a woman's last menstrual period, then we're going to change the dating of that pregnancy to match the dating gained from the ultrasound. But if there is a discrepancy, which there most times will be, because like I said, ultrasound is accurate but not exact, And if that discrepancy is less than 8%, then the pregnancy's dating is still going to be determined using the first day of a woman's last menstrual period. So there you have it. Pregnancy dates can be stated in terms of how far along the pregnancy is from the first day of the woman's last menstrual period, how far along the pregnancy is from the likely date of ovulation and fertilization, this date of course being 2 weeks after the first date of the last menstrual period, or how far along the pregnancy is using measurements generated from the earliest ultrasound in a pregnancy. However, remember the rule of 8s. We're not going to change the dating based on that ultrasound unless there is an 8% or greater discrepancy. And it's safe to say, guys, unless your doctor tells you otherwise, we likely are dating your pregnancy using the first date of your last menstrual period. So there you have it. I hope that made things at least a little bit simpler. If you have any questions about this topic or any topic, please go to www.twindoctorstv.com and visit the Contact Us section. There you can submit your question. For Twin Doctors TV, I'm Dr. Jamil. Until next time, stay informed and stay healthy.
Twin Doctors TV. Educate, inspire, entertain. Follow us at www.twindoctorstv.com and on Facebook, Twitter, Instagram, and YouTube. Stay healthy. Bye now.